Dear friends, warm welcome. Today we are going to discuss about COVID vaccination. What documents are required for registration of eligible beneficiary? How do I prepare myself online for an appointment for vaccination? Where should I register for the vaccination? Is it compulsory to take vaccine? Are these vaccines safe? Which vaccine to go for? Do I have a choice to choose vaccine? What side effects are expected? Is there still a possibility of me getting infected even after COVID-19 vaccination? And so forth. So we are going to watch the entire video so that we will understand what informations are required. We will divide this discussion in 6 sections. Section A. Vaccination registration in the government protocol. Section B. About the vaccine. Section C. Who will get the vaccine? Section D. How will be vaccinated? Section E. What do we expect before vaccination? Section F. What do accept after vaccination? So first section A. Vaccine registration. I will discuss today in question answer format so that it would be easy to understand. Where should I register for the vaccination? Register on the COVID portal and schedule your vaccination appointment. Here is the link. Where can I get the vaccine form? Vaccines are available from the government and the private health facilities as notified, known as COVID vaccination center. How do I prepare pre-register myself online? From an appointment for vaccination. Online registration and appointment can be done through COVID portal. You will have to give some basic information about yourself and detail of your photo in the identification card to get yourself registered online. From one mobile phone number, one can register 4 people. However, each person will need their own photo identification documents. If Aadhaar card is used as identification document, consent will be obtained and recorded. Through the portal, you find out the list and available COVID care centers and date and time of available vaccination slot to book an appointment as per your choice. You will need an appointment verification prior to register and confirmation token will be guaranteed after registration. You will also give an confirmatory SMS later. For all private hospitals, prior registration and appointment will be only method to register. For government hospitals, a few slots will be available for online registration and appointment. The rest will be kept for one site registration and vaccination. Appointment and date of vaccination center will be closed at 12 p.m. on the date prior to the date. Our next question, if I cannot pre-register myself online, how do I register on the spot and get vaccinated? Those who cannot get themselves registered online, you can contact the local government health workers who will help the beneficiaries to the government COVID center for the post-registration appointment, verification and the vaccination on the same day. Please ask your nearest government healthcare workers to guide about the nearest government healthcare center where COVID vaccination will be available and the days of the week when this will be available. You need to carry your mobile phone and a photo identification document to get yourself vaccinated. The workers in the government COVID center will help you to register on the spot, get appointment and get vaccinated on the same day. The appointment is available for the people who are age of 45 only. Our next question, can a person get the COVID-19 vaccination without the registration with health department? No. The registration of beneficiary is compulsory for vaccination for COVID-19 vaccine. Our registered notification and information about the vaccination, the date and time will be shared with the beneficiaries. There will be a provision for walk into vaccination center, but they too would be need to register one side before vaccination. The walk-in option is available for people above the age of 45 only. Next question, what documents are required for registration of eligible beneficiaries? Aadhaar card, driving license, health insurance, smart card issued under the scheme of Ministry of Labour, Mahatma Gandhi National Rule, Employment Guarantee Act, job card, official identity card issued to PMs, MLAs, LAs, PAN cards, passbook issued by the bank, post office, passports, service identification card issued to employees by central government public limited companies. Voter ID, people with chronic disease like diabetes, hypertension will have to carry the certificate of this disease by a registered medical priorities. Next question, will a photo ID be required at the time of registration? The photo ID proceed at the time of registration must be produced and verified at the time of vaccination. If a person is not able to pursue photo ID card at the session site, whether he be vaccinated or not, photo ID is a must for both registration and verification for beneficiaries at session site to ensure that the person is vaccinated. Next question, how will the beneficiaries receive information about due date of vaccination? Following online registration, beneficiaries will receive SMS on the registered mobile number about the due date, place and time of vaccination. Next question, will I get any certificate that I am vaccinated? Yes, a professional certificate would be provided after the first dose. One completion of the second dose when you will receive the message from the completion of schedule. It could include a link download digital certificate of vaccination of your use. This certificate can be saved in the DG Locker. Now let's discuss about section B. This section is about the vaccine. Our questions in, is Covishield same as the vaccine been given in UK by AstraZeneca? Yes, Covishield vaccine manufactured by the Serum Institute of India is based on the same patent technology as the AstraZeneca vaccine. What is the dose schedule of both the vaccines? The time interval between two doses of the Covishield vaccine has been extended from 4 to 8 weeks to 12 to 16 weeks. The second dose of Covaxin can be taken 4 to 6 weeks after the first dose. Next question, do I have a choice of vaccine I will receive? The vaccine will be supplied to various parts of India as per the availability and distribution plan, beneficiaries load, and so at present the option of choice of vaccine is not available. Next question, is it compulsory to take vaccine? Vaccination for COVID-19 is voluntary. However, it is advisable to receive complete schedule of COVID-19 vaccine for protecting oneself against this disease and also to limit the spread of this disease to the close contacts including family members, friends, relatives and co-workers. Next question, will the vaccine be safe as it is being tested, introduced in such a short time? Vaccine will be introduced in the country only after the regular bodies clear it based on its safety and efficacy. Next question, will the vaccine introduced in India be as effective as the other introduced in the other countries? Yes, the COVID-19 vaccine introduced in India will be as effective as any vaccine developed by other countries. Next question. Are these vaccines safe? These vaccines were fast-tracked, but the part that were fast-tracked were the paperwork. So the administrative approval, the time to get funding, those were all fast-tracked. Because these vaccines have such great interest, the time it took to enroll patients was very fast. The follow-up was as thorough as it is for any vaccine, and we now have months of data of patients who received the vaccine and who did not receive the vaccine, and we have compared the side effects between who have received, who have not received. And the side effects other than injection site reaction is not different. The side effects to the vaccine are very mild, so some of them are quite common. Those includes injection site reaction, fever, chills, aches and pain. Next question. Do the COVID-19 vaccine protect against the COVID-19 variants? While research suggests that COVID-19 vaccines have low efficacy against the variants, the vaccines still appear to prove protection against severe COVID-19. Further research is needed. Let's discuss section C. Who will get the vaccine? Can a person presently having COVID-19 confirmed or suspected infection be vaccinated? Person with confirmed or suspected COVID-19 infection may increase to risk of spreading the same disease to others at the vaccination site. For this reason, infected an individual should defer vaccination for 14 days after the symptoms resolution. Next question. Is it necessary for a COVID-19 recovered person to take the vaccine? And if I had COVID-19 vaccination was treated, why should I receive the vaccine? Yes, it is advisable to receive complete schedule of COVID-19 vaccine, irrespective of past history of infection with COVID-19. This will help in developing a strong immune response against the disease. Section D. How will be vaccinated? Out of multiple vaccines available, how is one or more vaccine chosen for administration? The safety and efficiency data for clinical trial of vaccine candidates are examined by the drug regulator of our country before granting the license of the same. Hence, all the COVID-19 vaccines have received license will have comparable safety and efficacy. However, it must be ensured that the entire schedule of vaccination is completed by only one vaccine, as different COVID-19 vaccines are not interchangeable. Next question. Are there many preventive measures and precautions that one needs to follow at the session time? We request you all to reset the vaccination center for at least half an hour after taking the COVID-19 vaccine. Inform the nearest health authorities, A&M, ESHA, in this case you feel discomfort or uneasiness subsequently. Remember to continue following key COVID-19 appropriate behaviors like wearing of masks, maintaining hand sanitizers and physical distance, or 6 feet or 2 gaj. Section E. What to expect before vaccination? Which vaccine is better between Covishield and Covaxin? There is no head-to-head comparison done between two vaccines being used in India, so we cannot choose one over the other. Both could work fine in preventing the infection as well as prevent a person from going into service state of disease. As a long-term effect, it would be preventing death for elderly people or those who have comorbidities. In fact, India has authorized 3 COVID-19 vaccines. Covaxin developed by Bharat Biotech, Covishield developed by Oxford AstraZeneca, Sputnik V developed by Russia. Kindly note, All these vaccines have 90% effect to protect you from COVID-19 disease. So you may go for any of this vaccine available. Next question. What medications should be avoided before taking COVID-19 vaccine and for how long? Currently, there is no such instructions. One can take regular medicine just to inform the vaccinator about the medicines to consume. Next question. If one is taking medicine for illness like cancer, diabetes, hypertension, etc., can she take COVID-19 vaccines? And or if she is suffering from hypertension, diabetes, severe kidney disease, heart disease, lipids, disorders, etc., can I safely take the vaccine? Yes. Persons with one or more these conditions are considered among the high-risk categories. They need to get COVID-19 vaccination. Overall, the vaccine is safe and efficient in adults with comorbidities. The maximum benefit of getting the COVID-19 vaccine is for those who have such comorbidities. However, it is very concerned for specific reason. Please consult your doctor. Section F. What to expect after vaccination? Do I need to use the mask, other COVID-19 appropriate precautions after receiving the vaccine? Yes, it is absolutely necessary that everyone who has received the COVID-19 vaccine should continue to follow COVID-19 appropriate behavior. Mask, 2 गज की दूरी and hand sanitizer to protect themselves and those around from spreading the infection. Does vaccination protect me against over strains mutated virus of SARS-CoV-2? The body is responding vaccination by making more than one type of antibodies to virus part including spike protein. Therefore, all vaccines are expected to provide responsible amount of protection against the mutated virus also. Based on available data, the mutation as reported are unlikely to make the vaccine ineffective. Next question. In how many days will the vaccination create an adequate immune response and protection? Adequate immune response take 2 to 3 weeks after completion of entire vaccination schedule. That is, after the second dose Covishield and Covaxin. Next question. It is important for me to receive the same vaccine during second dose? Yes. As the vaccines available are not interchangeable, it is important to receive second dose of same vaccine as the first dose. The COVID protocol is also going to help to ensure that everyone receives the same vaccine. Next question. Does this vaccine provide herd immunity? When an increasing number of people get vaccinated in the community, direct protection through herd immunity develops. The percentage of people who need to be immune in order to achieve herd immunity varies with each disease. For example, it's 95% US. However, the protection of the population of the must be vaccinated against COVID-19 to be included herd immunity is not known. Next question. Is it okay to take an over-the-counter planned medication before or after getting a COVID-19 vaccine? It isn't recommended that you take a planned medication before getting a COVID-19 vaccination to prevent possible discomfort. It is not clear how medicines might impact the effectiveness and the vaccines. However, it is okay to take this kind of medication after getting COVID-19 vaccination, as long as you have no other medical reasons that you could prevent you from taking it. Next question. Can I get a COVID-19 vaccine if you have a history of severe allergic reactions not related to vaccines or injections medications? You may still get a COVID-19 vaccine. You should be mandatory for 30 minutes after getting the vaccine. If you have had an immediate allergic reaction to other vaccines or injectable medications, ask your doctor if you could get a COVID-19 vaccine. If you have ever had an immediate or a severe allergic reaction to get any injections in a COVID-19 vaccine, the CDC recommends not getting the specific vaccine. If you have an immediate and severe allergic reaction after getting the first dose of COVID-19 vaccine, do not get the second dose. However, you might be able to get a different vaccine for your second dose.